Do you find your mood changes unpredictably? Are you subjected to mood swings on a regular basis? Well, then this video is for you. Remember, if you don't want to miss out on any of these videos, please do subscribe and switch on your post notifications. Life can be really difficult if you find that your mood changes unpredictably, and this can vary in severity. Some people will notice that their mood is unregulated or their emotions change quite frequently throughout the day, sometimes without a trigger. Others will notice a change over a period of a few days. And others still experience extreme changes of mood, from very low depressive episodes to intense periods of elation over a period of weeks and even months. This spectrum of changeable mood is caused by different things. And in this video, we'll be exploring the different types of conditions and causes for what might be causing you to experience mood swings. Now, on the less severe side, we talk about emotional dysregulation. Now, for most of us, where there's healthy mental health, our emotional state, our thoughts tend to match the situation that we're in. Our emotions are appropriate to the time, the place, and the situation. And even if difficult emotions come up, we are able to read them and we're able to action them and see what they're trying to tell us in a measured manner. But when our mental health is off balance or is impaired, this can lead to variations in how our moods come about and how manageable or unmanageable they are. When our mental health is not at its optimum, the milder end of the spectrum with emotional dysregulation is something that is experienced probably by most people. It's in response to situations like not eating enough or eating in an irregular way, so you get blood sugar spikes and lows. It also may be a response to not getting enough sleep, and you may find you're more irritable or flying off the handle more than you usually would, or maybe even sensitive to triggers more than you normally would be. But as we move further along the spectrum, you'll find that there's some of you who may find that regardless of whether you've eaten or slept well, you generally tend to run at having your emotions go up and down throughout the day, sometimes not even quite sure what the trigger is. And for some people, this may happen over a period of a week or even a couple of weeks. But the main thing is the emotions feel dysregulated to a point where you feel like they're out of your control, and you almost feel like you're run by your emotions. And you might not even know what you should do next because you might be fearful of, hang on, will I be prepared for it emotionally? Now, this level of emotional dysregulation can happen in many conditions. So it's important that you speak to someone about it and try and understand some of the other things going on around it. For example, emotional dysregulation can be a feature of borderline personality disorder. It can be a feature of anxiety. It can be a feature even of depression and post-traumatic stress disorder, where emotions can go up and down unpredictably because you've got something going on inside that's just trying to push its way out and hasn't been addressed. ADHD is another condition in which emotional dysregulation is very prevalent, and that's because ADHD is a disorder of regulation. However, you'll find other things in your life are also dysregulated. When you go to the more extreme side of emotional dysregulation, or what most people would call an actual mood swing, where there's severe, intense episodes where one moves from very deep states of feeling low to extreme states of elation, this is more likely to be something like bipolar affective disorder. Okay? Some people call this manic depression. In manic depression or bipolar affective disorder, a lot of it's explained in the name. Bipolar, two sides to it. Affective, your mood or your affect, and disorder. So the polarization of your mood is disordered. It's not relevant to the situation. Good things could be going on in your life and you might get depressed. And terrible things might be going on in your life and you might have an extreme manic phase or hypomanic phase or elation. Now, with bipolar affective disorder, it's really important to differentiate that this is not regular day-to-day emotional dysregulation. It's not related to just lack of sleep or not eating regularly or properly. With bipolar affective disorder, there are certain other features which really distinguish it from the emotional dysregulation that might be part of a personality disorder or anxiety or even something like ADHD. The key thing you're looking at with bipolar affective disorder is that the periods of feeling very low or feeling elated are very clear, and they last for a few weeks. They often last for a few weeks, although in some rare types they can last for a few days. They're usually not related to your circumstance, and they're often at an intensity which impairs your functioning. So the low mood hits you so hard that you may not be able to get out of bed, or you may find that you lose interest in things. You may not eat or sleep properly. You may oversleep or overeat. You may undersleep and undereat. So this is a clear episode of depression. Equally, when you have the manic phase or the hypomanic phase, the mood is elated, not in the same way it would be if you're excited about something or something really good's happened in your life, but elated to a point where one loses the rational ability to see what's going on around them. So one may have beliefs that are not consistent with reality. For example, being elated because you think you have magical powers. Being elated because you think you're a millionaire when you don't actually have that in your bank account. So these are known as delusions. They're fixed, firmly held beliefs which are false. And they're often generated with a rationale which is irrational. So the elation or hypomania or mania is rooted in a false or imbalanced sense of reality. With mania and hypomania, you can also get hallucinations. You can get auditory hallucinations. You may hear things that other people don't hear. You may see things other people don't see, so visual hallucinations. So this is another side of how either the mania or the depression can also affect your perception. So this really sets bipolar affective disorder apart from the other causes of more milder mood swings or emotional dysregulation. I'd love for you to join this community and shape the content we produce. Please subscribe by clicking the link below.